Hello students, this is a lecture on Chapter 5, The Muscles of Facial Expression. The surface features of the face are created by the underlying bone, muscle, and connective tissue. The types of surface features that are seen on the face are grooves, lines, elevations, ridges, and fissures. Facial features can be altered under normal conditions due to age, contraction of muscles, and changes in the amount of connective tissue present. Pathology can also alter facial features. The dental hygienist must learn to distinguish between normal versus abnormal changes, such as facial palsies. Take a look at the picture shown here and demonstrate the prominent features on the face of the student sitting next to you. The muscles of facial expression are embedded in the skin of the face, the neck, and the scalp. They express emotions such as joy, sadness, or surprise by smiling, frowning, grimacing, etc. The muscles of facial expression are innervated by the facial nerve, cranial nerve 7. These muscles are named according to their location, their function, and their size. The muscles of the upper lip include the orbicularis oris, which surrounds the mouth and acts to close, compress, and pucker the lips. The risorius muscle originates in the fascia over the parotid gland and inserts into the corner of the mouth. It acts to pull the corners of the mouth laterally. The zygomaticus major muscle originates in the zygomatic bone and inserts in the corner of the mouth. It acts to elevate the corners of the mouth. Superficial elevators of the upper lip from lateral to medial are the zygomaticus minor muscle, which originates in the zygomatic bone and inserts on the upper lip, and the levator labii superioris muscle, which originates on the lower rim of the orbit and inserts into the upper lip. The levator labii superioris achinasi muscle originates in the frontal process of the maxilla and inserts into the upper lip and ala of the nose. Its action is to elevate the ala of the nose and the upper lip. The muscles of the mouth on the lower lip include the depressor anguli oris muscle. It originates on the border of the mandible and inserts into the corner of the mouth, which pulls the corners of the mouth downward. The depressor labii inferioris muscle originates on the border of the mandible and inserts medial to the corner of the mouth. It pulls down on the lower lip. The platysma muscle originates in the fascia of the pectoralis muscle and inserts also into the corner of the mouth and pulls down on the mouth. The mentalis muscle originates in the mandible below the lateral incisors. It inserts into the skin of the chin. Its action is to push up the lower lip and wrinkle the skin of the chin. The buccinator muscle originates on the pterygomandibular raphe, inserts into the mandible and maxilla, and it acts to tighten the walls of the cheek, assisting in chewing by keeping food in the mouth. The orbital portion of the orbicularis oculi muscle encircles the eye and the palpebral portion is in the eyelids. The action is to close the eyelids. The corrugator supercilii muscle originates in the superciliary ridge and inserts onto the bridge of the nose. It pulls the eyebrows medially and causes vertical wrinkles between the eyebrows. The procerus muscle originates on the nose and inserts on the skin medial to the eyebrow. It acts to move the eyebrows downward and medially, causing horizontal wrinkles of skin on the bridge of the nose. The epicranius or occipitofrontalis muscle consists of two portions. The frontalis portion, which originates on the frontal bone and inserts on the aponeurosis, and the occipitalis muscle, which originates on the occipital bone and inserts into the aponeurosis. It acts to cause horizontal wrinkling of the forehead. The nasalis muscle acts to open and close the nostrils. The superior, middle, and inferior auricular muscles are rudimentary muscles that can move the ear on some people who are very talented. Please review the muscles of facial expression that are listed on the left of this slide from the anterior view. Now review the muscles from the lateral view. This concludes this lecture on Chapter 5, Head and Neck Anatomy.